surface is or which one is concave and which one's convex?
Tail curls concave.
Okay, so the talus is
Or sorry, the
Convex.
convex,
Yeah.
right?
Tibiofibular.
Is going to be our concave portion, right? Okay, so I'm going to have
You're just, I was like, what is he saying?
I'm going to remove your shoe. So, if I want to increase her dorsiflexion, which direction do you think I need to mobilize?
Posterior.
Posteriorly. Why?
Convex. Do
It's
the opposite.
convex, so it's on.
It's convex, and so it's going to glide in the opposite direction of the roll. Okay? Because as she comes into dorsiflexion, here's our talus or our talus and fibula, or
Fat bone, we're good.
what am I talking about? Call.
Some bones.
Tibia and fibula. Okay? And then we've got our talus that sits up in here. And again, if we don't glide posteriorly, then just pop out of socket. So the body just does this nice little posterior glide. Right? So what's the open back position for the foot?
10 degrees.
About 10 degrees plantar flexion. Resting position for most people. That is perfectly fine right there. Okay? We want to get our distraction. When we start getting into like the shoulder, the hip, the ankle, now we've got to use our hands a little bit more to get that distraction. Okay? So what I do is, the way I was taught, was kind of overlap your hands like this, and then as you drop your fingers down next to each other, so I'll kind of go in like this, and then as I drop my fingers down next to each other, if I've got a good enough hold on her, then it's going to automatically give me some distraction, okay? So I come in like this, and I just drop my fingers down. You feel that little distraction right there? Okay? So I've got my distraction, I'm in the right position. Let me get a better hand placement here. And my top hand is essentially right over the malleoli, okay? Maybe a little inferior there, just so I can get better distraction. And then the top hand, or my hand over her foot, is just wrapping around, and then I've got my little distraction. And the table is stabilizing the proximal segment. So all I have to worry about now is moving the distal segment. Okay? And I'm just going to go straight posterior. One thing with the ankle that a lot of people, the ankle and the hand, a lot of people have a habit of doing, is they'll do this. Do not do that. Okay, mobilizations, straight mobilizations are supposed to be straight. Okay, we have our treatment plane, and we want to stay right in line with that. We don't want any motion other than just straight up and down, straight anterior, posterior, however we need to do to be occurring. Okay? So again, it's you come in here, I'll get my arms locked out, and then I just push with my right hand posteriorly. Okay? Now to do a mobilization to increase plantar flexion, just go in the opposite direction, right? Because now it's got to glide anteriorly, so this stays in there. But if I come in here like this, which you can, but it may not be the most comfortable for the patient, because now you really got to hold on to that foot and you got to pull up, right? And unless you can wrap around the entire foot, it's not going to be comfortable for the patient. So if this was somebody with a big foot, I wouldn't be able to wrap around as much like I am on her. I wouldn't be too worried with her. I can still get a good handle on it, getting good mobilization. But if it's a little bit larger, now I can come in here and just wrap my hand around her calcaneus, stabilize the tib fib, and then pinch her up against my body. Give it a little distraction, and then pull straight up to get that mobilization. Okay? So that's the ankle. How we doing?
Good.
Everybody good?